Welcome to Pregnant Possibilities. I'm Jeanne Schumacher, co-founder of the Pregnancy Advantage, and my partner is Dr. Debra Shapiro, a board-certified OB-GYN. And today on our show, we're going to be discussing what working on your health prior to conception. How can we do that? And we have a very, very special guest today. We have Dr. Christina Miller. She's double board certified in emergency and integrative medicine. She worked for 10 years in the emergency department and served as president of Colorado American College of Emergency Physicians. Due to her own health concerns, she radically changed her own self and her practice as well to lifestyle medicine and health promotion. And you can currently find her. She's working at plant-based-telehealth.com. So thank you, Dr. Miller, for taking the time to be with us here today.
Oh, you're welcome. Thank you. It's my pleasure. Such an honor to get to talk to you guys today.
Thank you, Christina. It's really, really wonderful. This is really fantastic to talk to someone also who is double boarded both in traditional medicine, but also as an integrative medicine doctor, because I don't know that much about integrative medicine. Maybe you'll be able to talk about that a little bit either now or at a later time. But I wanted to ask you to start off, you know, our program is all about trying to get our bodies to heal and reverse disease and optimize nutritional status and remove toxins all before a pregnancy so that our next generation can be healthier than the one preceding it. Something that I'm seeing a lot in my practice, and I did see a lot in my practice, was that women were getting heavier and heavier, and there was a lot of pre-diabetes and diabetes, and earlier, we were diagnosing gestational diabetes earlier in pregnancy. And it's just becoming more of a common problem. And I'm just wondering what your experience is in reversing type 2 diabetes. And is it really possible in the time frame that we have, that women have, let's say they want to take 6 months or a year to get ready before they get pregnant, could they reverse diabetes in that time frame?
Absolutely would be my quick answer. And it's so great that you guys are working with women to do that. Like, what an amazing goal, though. Their next generation, their children have such an advantage because of that. So it's wonderful. So yes, with the cool thing about diabetes, especially type 2, is that when we can encourage weight loss and we can change our food so it's more fiber rich, we change our microbiome over, and pretty quickly we start to see less of these blood sugar spikes and more blood sugar staying within the normal range. So then we get less insulin spikes, and it actually becomes easier to lose weight. And by just changing the type of diet people eat to a more fiber rich diet and taking off the foods that promote high insulin levels, we can have tremendous results. And I even work with pregnant women, as I know you do too. And so right away we can start to see results. It's amazing. People can fully reverse or get significantly better. Absolutely.
That's fantastic. That's fantastic. You know, I was looking at the dietary guidelines, and also with my experience when I was at Kaiser, that legumes, things like lentils, were considered more of a carbohydrate food. You know, they still treated diabetes by reducing carbs, and I think of them more as a protein-rich food and more of a high fiber food that would be excellent for diabetes. I know people are really afraid of carbohydrates. I hear that all the time, right? They're afraid of carbohydrates especially when they're diabetic. Do you have any words of wisdom for them?
I do, actually. So I am, as an integrative medicine physician, I take a more holistic look to the person, to the body. And so I'm looking at everything, and the same thing with the food. I don't just see food as a carbohydrate, right? My breakdown is more, is it processed or is it a real food? Process is where I draw the line. So that's what I don't want people eating. Animal products as well. The new data over the past, I don't know how many years, 10 years, maybe probably 20 years, even longer, but that it's become more common and accessible to us, has shown us that the animal products we're eating is leading to these insulin spikes. And so it actually takes quite a bit of insulin when we eat animal protein to metabolize it. So people aren't able to tolerate higher carbohydrate rich foods, even if they're not processed, such as a banana or oatmeal or lentils, like you said, because they're eating these animal products, and then which is triggering our high insulin load. So when we take those animal products and higher fat foods out, when we remove all of that, they're no longer getting those insulin spikes. So now we give them the fiber. And again, I see food as holistic. So lentils, to me, I see it as a prebiotic. So like you said, the fiber, it's feeding our microbiome. It's doing so many benefits to us. The fiber in that as well is going to keep our blood sugar in this range and prevent those spikes. It actually has what's called the double bean effect or second meal effect, where you eat beans for, let's say, lunch, and even at dinner time, you're going to have less of an insulin spike because you ate beans at lunchtime. So people who eat beans at night, it's going to help them overnight to keep it more regular. So when we look at long-term outcomes and patients that are eating these foods, oh my gosh, it's tremendous. So we can't call it carbohydrate anymore. Now we say it's loaded with wonderful amino acids. It's prebiotic fiber. It has fiber, and it has so many minerals and nutrients. It's protected for bone health. So many wonderful things. It has calcium in it that I want my patients eating for longevity, and the data supports that. So yeah, I try to help my patients see it differently so that they want to eat these foods too. Then they start to understand, and they'll rapidly see the changes when they do this.
Fantastic. Yes, exactly. Thank you so much.
Absolutely.
So since we're talking about food and we're talking about processed versus unprocessed and refined versus unrefined, and food that sort of, as it comes out of the ground, there are a couple of different ways of producing food that's coming out of the ground. And there's organic and there's non-organic, and there's also something called veganic, which we won't even talk about, but let's just organic versus traditional method of growing food with pesticides and herbicides, or more pesticides and herbicides. Do you feel that this is an important switch for folks to make, and why? Why or why
That's
not?
a wonderful question. And I do actually support organic foods, especially for patients who are looking to get pregnant down the road. Absolutely. So, and I'll say that, first of all, I never want diet to stress anyone out. So I always recommend, first and foremost, we do the best we can, that we don't strive for perfection. I don't want any of my patients like, oh my God, if it's not organic, I can't eat it, I'm going to die. Like, I really try to stress that too. But yes, to make an effort for organic as much as we possibly can, or if we can afford it, or certainly we'll talk about this, picking the foods that are more contaminated, eating those organic. But so there's good data, which I know you must be all over given what you do, but that the chemicals and pesticides are transferring over through the umbilical cord, and they're being found in the fetus. And I was reviewing this before I came on, and there's a good study from UCSF, so University of California in San Francisco, and they looked at 59 different pesticides in 77 pregnant women, and they found that 80% transferred over to the fetus through the umbilical cord. And some of the different ones, the PCBs, chlorinated biphenyls, thank you, and the PDBEs, which are inflame retardants, some of those were even higher in the fetus than they were in the mom. And so these are actually known to be harmful to infants, and so they can cause premature labor, and they can cause the need for C-section, and things like that you help patients with. So I do recommend we do our best to get organic. It is worth it to me. And if we can't get organic, to peel it, to wash it very carefully, and to do our absolute best with that.
Thank you. Was that paper by Dr. Woodruff by any chance? Was that by Tracy Woodruff?
It is source UCSF News. This was from 2016. It's a great study. I have it printed up here. It doesn't say her name here, so it just says UCSF News. But it's in OB-GYN, maternal fetal medicine is where I found
very
it.
Involved in that research.
There's stuff from years ago too that I've looked at over, and PCRM, Environmental Working Group, EWG.org, they have done quite a bit with it too. And they have shown that it's transferred over too. But that was kind of international. And this was the first time they're like, well, let's see what our American women are experiencing. And sure enough, there it was. So.
Yes, and it's, people also live closer to, people who have lower socioeconomic status are also living closer to sort of, they can be near dumps of toxic materials, and have more contaminated water. And this is a huge problem. And I'm not sure how much control people have. If you live next to a freeway, you may not be able to control, your air pollution, your ambient air pollution, but there are things that you can control. So if possible, you look at that environmental working group, the Clean 15 and the Dirty Dozen, and
Mm-hmm.
really the food that's on the Dirty Dozen list, which gets upgraded every year, I would really try to avoid that whenever possible.
Absolutely. And that's what I recommend as well. Follow the Dirty Dozen. And then the Clean 15, you don't necessarily have to. If you can't afford it, that's okay. You know, again, you're doing the best you can. And I do, if you things like air purifiers inside, plants, like we just do the best we can, small changes. Eating more green leafy vegetables helps you detoxify some of this even more. So every little step that we can take is helping us to minimize this exposure. So.
Right. I mean, people always talk about detoxes and these, like juice fast and all this stuff for detoxing, but I don't think they really understand that it's your liver that really does the detoxification in your body, and you need these phase 2 enzymes. And what really helps those phase 2 enzymes is the sulforaphane from cruciferous vegetables. You need to eat your cruciferous vegetables.
Yep. And the sulfa from things like onions and garlic and all your cruciferous vegetables. Yep. That's exactly right. And so most Americans don't eat enough of that.
No.
It sounds like you guys are talking whole food, plant-based.
Absolutely.
Yes.
Right?
That's part of my detox plan for my patients. So absolutely.
Thank you. Thank you for everything you do.
Thank you.
Well, inflammation. Gosh, we just seem to be so inflamed, our bodies all the time. I mean, this is one of the biggest chronic things. I mean, it's a symptom of bigger underlying pieces or allergic reactions. So in part of our program, before pregnancy, we want to try and get these things under control. So what are some of the things you recommend for women to deal with inflammation and allergies?
Absolutely. That's a wonderful question. And that's something I see quite a bit in my practice and I help people with all the time. And so again, taking a holistic approach, inflammation can come from all different sources, but predominantly, if our gut is out of balance, if our microbiome is out of balance, we're going to have systemic inflammation, which can trigger things like allergies to hay fever or food allergies, right? Different types of external allergies that are our body overreacting. So it's an overstimulated immune system. We can see things like autoimmune diseases. We can see things like achy joints. People wake up a little sore, achy, stiff, right? Those types of things. Cardiovascular disease, even diabetes, metabolic syndrome, right? This is going to be just gaining weight and having a difficult time losing weight. That's going to tell me that that person is inflamed right now. And all of that is signs when we look at blood work or we think about the underlying, what's going on in the body, what's causing this. And that's where we want to address the person as a whole person. And we want to correct that gut, and we want to eat anti-inflammatory foods, and we work on a program to reduce stress and learn tools to navigate the stressful world that we happen to be lucky enough to live in right now. And so we give ourselves tools to navigate that as well. We work on just the right amount of exercise. We work on sleeping, eating our plant-based whole food diet, and that's going to make a huge difference on inflammation ahead of time. There are things, so if someone's gut is out of balance, if they're having loose stools or constipation, that we will work on more specific programs, tailoring it for that person, because each person's microbiome is different. And if the gut has gotten damaged and we're having a lot of inflammatory symptoms, we're going to really work hard to correct that gut, to remove the trigger foods that are causing the sensitivity or the intolerances, and add in anti-inflammatory healing foods, which may look like more raw green vegetables, anti-inflammatory foods such as turmeric or ginger, garlic, cinnamon, cloves, things like that. We may add those in, rosemary, and we're going to do more fluids, maybe a little bit of watch what time people are eating, time restricted eating a little bit. So we play with, there's a lot of different things we can do to reduce inflammation. And there's certain foods that are high in quercetin, which is actually antihistamine food that's natural in our fruits and vegetables. It's particularly high in the skins of our organic apples and in onions. So we eat these foods, we're getting natural antihistamine already. And studies show that people who eat less than 7 to 8 servings of fruits and vegetables per day have significantly more allergies than people who eat more. So we're working hard to give them antihistamine, anti-inflammatory foods, remove the trigger foods, which is what I help work with my patients on, and bring in the whole food plant-based diet and get their immune system more robust so that their allergies and their inflammation can decrease slowly over time. It's wonderful when we see it working.
I love that you said, and this just resonates with me, that every body is different. Because while we're very similar, you know, genetically, each person is going to have a different reaction. Like I know, for example, for myself, I can't do salt at all, at all. And even just the smallest amount will cause me to have an increased amount of liquids and will raise my blood pressure without question. I mean, even within, as soon as I've eaten the meal, my blood pressure will start to go up. It's that big of a deal for me. So I think a lot of people that I think they need to understand that it's learning how, you know, we didn't get a manual when we came out of the chute, you know? So
It's a good idea though.
I know, right? I told Neil Barnard, I said, you need to write that. I'd buy that book in a heartbeat.
Yeah, it's a good idea.
That needs to be written for sure, because we didn't come out with this owner's manual, and it's kind of been like, hey, hit or miss along the way. And we're starting to now see that there are certain things that, you know, like for me, I can handle caffeine. That doesn't bother me. It doesn't, you know, it may stimulate my nervous system, but I'm not aware of it. You know, it doesn't impact my sleep. And not that I drink caffeine, I don't. But if I were to consume something with caffeine in it, it wouldn't bother me. Whereas other people, I know it'll keep them up for days. You know, just even like to have one cup of coffee will keep them up for quite a while. And so I think it's learning how your body reacts to these things. And I think that's what I just love what you said, was that every person is different. So
we really are. Even like caffeine, that's such a perfect example, Jeanne, because we have genes to break down and metabolize the caffeine, but depending, and that's in the liver, it's part of our liver. And some of us have fast ones that break it down quickly, and those people can drink it, like you said, and go to sleep. And some people have slow genes where that breaks it down slower. It still metabolizes it. There's nothing wrong with anybody, but it just is very different process in that person. And those people will drink it in the morning and still feel it that night, and can get jittery from it, can get anxious from it. And actually in those people, it's not going to have the benefits that it does in the people who can metabolize that fast. And so it's completely different. And so it's hard sometimes to say, oh, this is a good food, it's a bad food. We know in general that a whole food plant-based diet promotes longevity and helps reverse disease. We know that. There's so much evidence. That being said, when people are switching over, we're going to tolerate different things. People may have inflammation and gut issues and have food sensitivities, or they may not make one person feel good the way it does other, or we have to train our guts like a muscle and start slowly and building up the resistance for it too. So there's different ways that we add the foods in so that people get to the healthy place, because we're starting where we haven't always necessarily lived the best lives in the past. And so now we're left with these, you know, fixing it. So absolutely, it's such a good point that we are unique.
yes, for sure.
And we have unique microbiomes. So that's going to be, yeah, every single microbiome is just like a fingerprint. It's going to be unique. So that's why one person may tolerate 2 cups of beans, my husband, easily, no problem. Another person may not tolerate that much, right? So we have different microbiomes. And so some of it we can adjust though. We can develop it.
And I'm so glad, because honestly, I mean, and I think about things like what you just said about the microbiome, like if you have like a colonoscopy, I can only imagine what that must do to the microbiome without question. And because you're trashing it to get ready for the, you know, the colonoscopy. I mean, you have to clean your system out, and I can only imagine what that does.
Yeah, no, everything that we do, it's very sensitive to everything. It knows our stress, so that affects it tremendously, actually. Whether we go outside or not affects it, the air that we're breathing, of course, the food that we're eating, but so many things. The time of day, it's different at night from the morning, actually. So it's different seasonally. It's like our bodies. It's right there. Those little guys inside of us are right there with us every step of the way, no matter what's happening in our life. It changes as we age. I mean, isn't that amazing? It amazes me.
I think of it like, do you ever see the movie Men in Black?
Yes.
When Kay opens up the little locker and there's like this little colony in there.
That's awesome. I'm going to think of that now.
I know. That's what I think of our microbiome.
Man. Something like that, maybe.
Yeah. Okay.
But doctor, can I just ask one other question? We were just talking about the colonoscopy, and I believe that your microbiome comes back pretty quickly after that prep. I don't want people to, to be fearful. We just lost an amazing actor to colon cancer, colorectal cancer, and the gold standard still is a colonoscopy. And
Absolutely.
So
yeah.
I don't want people to be afraid. I mean, you're really just removing the stool. I think the bacteria is a little closer. I'm not sure that you're stripping away anyway, can you speak to this a little bit?
Yeah, absolutely. So everything, like I said, that we do does alter it. So it does alter it slightly, but it's not like taking antibiotics, and they're still in our gut, and you go right back to eating your whole food, plant-based, fiber-rich, prebiotic-rich diet because of all the fiber, and it comes right back. Yes. And I do recommend them as well to my patients. So I recommend we eat well, we take good care of ourselves, and we get our colonoscopies when our time is right. Absolutely. Good point. Mm-hmm.
Well, let's talk exercise. I mean, because that's one of the tenets of our program is we want you to be out doing exercise. I mean, we're not talking about going to the gym and bench pressing 500 pounds, but, walking or jogging or doing something before you get pregnant so that you have got your body in good shape. How important is this for good health?
It's everything. And that's what I would say. And I'm a movement fanatic, I would say. So I don't call it exercise as much. I love to move my body. So sitting here right now is hard for me. I'm already thinking, like, as soon as this is done, can I get in a walk before my next patient this afternoon? Like, I think moving our body is key to health for everyone. So I want everyone to remember that no matter what, to the day you die, your body is designed to move. And so I see a lot of people with joint pains. And I too, I had so many joint pains and stiffness and aches. And if I sit for too long, our joints, they have to be lubricated. They need to be moving, walking our hips, right? We need to be moving all the time, stretching ourselves. It keeps it lubricated. It keeps them cushioned. And so it's really, really, really important for our joints. So as people are looking to get pregnant, it can help prevent some of the back pain that women get. So it's really important to develop a routine before so you can transfer it into while you're pregnant and just continue it instead of starting it right then. Although if that's when you're starting it, you can work with an OB-GYN and start safely, and that's also awesome. But it's ideal if you can start it ahead of time, if you're able to do that. But it helps. I use it all the time for myself and my patients. I make all of my patients exercise every day, even if it's just 5 minutes. If that's all they can get in, we start with tiny steps, but we have to all move our bodies. And it could be indoors. I live in New Hampshire. It snows and it rains and it's beautiful. I have nice raincoats and I have winter coats I put on, or I walk through the house. I'll do squats. I'll do something to move my body and get my heart rate up a little bit. So I work on things with patients. What do they like or not like? Maybe dancing, maybe riding a stationary bike. We're all different. Again, we're different in what we like. So we have to find what works for us. But it also helps with fatigue, significantly helps with fatigue. So if we are feeling really, really drained, and I see a lot of them in my patients, who has enough energy in the day, right? We're all out of energy, it seems like, but exercising will really start to boost it back up. It's amazing. Even like 10 minutes, getting our heart rate up a little bit or moving our body, getting in a walk, and our energy is better. I do that instead of a cup of coffee now in the afternoon. I go for my 10-minute walk and I am like a new person. It's wonderful. So it helps with that. It helps circulate the blood. So we talked about diabetes, metabolic syndrome. So it's really going to help regulate the blood sugar and the insulin significantly. And I can tell my patients who are moving and patients who aren't, actually. So just a little bit, doesn't take much, a few minutes after a meal. Ideally 10 minutes, but if we can't get that in, we just do the best we can. If you can get in 5, that's great. So I plan my meals and make sure I can get in a little bit of movement time before. So it really helps with that as well. It can help with heartburn just by eating and then moving before we sit down or lay down. So again, these are things we're thinking for with pregnancy. And you know a lot more about the pregnancy stuff, but it can help with preventing C-sections or preterm labor, just a healthy body. Because remember, again, the holistic approach, when we have a healthy body, when we're moving lymph and waste and we're exercising our muscles, we're getting rid of things, and we're normalizing the insulin a little bit, and the whole picture, the inflammatory markers start to go down and everything starts to look different just by that little bit of movement. And so everything about it is important. And so the pregnancy is going to be healthier and more optimal. We're just giving ourselves the best shot, the advantage, as you guys like to say. And so, yeah, I can't say enough good things about it. Until the day we die, it helps prevent heart disease and neurodegenerative disease like Alzheimer's and Parkinson's and Lewy body disease and some of these terrible things that people have for movement. So it's non-optional for my patients, I say. Until the day we die, we have to figure out some way that we can move our bodies.
Fantastic. And
Yeah.
Jeanne always says they don't call it labor for nothing. And I would echo that now, that you really have to have that endurance. You can't be a couch potato and think that you're going to be able to do 24 hours of labor.
Fabulous point. I'm going to add that in when I talk to my women getting pregnant.
Well, that's Jeanne's line.
I love it, Jeanne. I'll give you credit. It's a great line.
Right.
Well, and plus, you know, I know you sit because you're doing a lot of telemedicine. Okay. One of the things that I do, I'm sitting on a ball.
That's good.
So all day long, because I do a lot of editing and stuff like that. So while I keep my hands up here and I'm, you know, doing the editing and stuff like that, but down below, I can make my body move. And I have to tell you, because I know that sounds weird, but I used to run wrestling tournaments. My son was wrestling and I did the software for it. So I, you know, did all the computer stuff, the technology. And I would be there from like 6 o'clock in the morning till these tournaments go on forever. And so I would be there till like 10 o'clock, 11 o'clock at night and sitting, because all they would be doing is entering data all day long. And I remember the first year I did it, I was sitting in a chair and I would get up to walk to the bathroom and I felt like I was 900 years old. And so next year I said, I'm bringing my ball. And he's like, I don't care, as long as you show up, I don't care what you do. So I brought my ball and I was sitting there bouncing all around in between data entry. And at the end of the day, I got up and walked away like I was normal. I like didn't have to like go through the, you know, from the time where I was sitting to the bathroom, it was way across the gym. I felt, you know, like I was walking like I needed a walker, you know, it's like,
yeah, it's for sure. Yeah, that's a great idea. I love the idea of a ball. So that's one thing. I have this little stand-up desk you can see right there.
Right.
So I stand there and then I'll stand for a patient and then I'll sit for a patient and then I'll stand. So I'm going back and forth always.
Get a ball. I'm telling you.
But I'll get a ball too. I love that. You look like you're having a lot more fun there than I am.
I'm telling you. It's a lot of fun and you can boogie around.
You get to move. You're right. You're building your core a little bit there. Like it's all good. It's all good what you're doing.
Absolutely. Yeah. And sometimes I'll just roll back, you know, and take a break and I'll roll backwards over the ball. And it's awesome. I mean, just, you know, and doing that core work, or my husband likes to come in and just sit with, you know, and have a little chat, you know, in between when I'm working and stuff. So I'll just swing around and I'll start doing some stomach crunches while we're talking.
I love that. That is an inspiration for all of us. So thank you. That's wonderful. Right. Great tip.
I hated sitting at work, and when I started working at Kaiser, I was given a standing desk, so I was able to stand. And now where I work at Genentech, I also just stand all day unless I'm with a patient in a room, and it makes such a difference. And some of the doctors are actually using, I don't even know what you'd call it, but it's like a hoverboard, but it's not.
I've seen those.
And it's tough. You have to balance, so you're constantly adjusting.
I love that.
I
love all of that stuff. I'm all about movement. And I used to have a really nice stand-up desk, but right now in this little makeshift office, I don't have it yet, but and then a hoverboard underneath and all of the stuff is good. So,
and Dr. Greger has
ideas. Walking treadmill. Yeah, he's up. Right. Even better. So I just think sitting, standing, moving, a ball, like these are all, we're moving our bodies. We're all about movement. So I've been sitting now for half an hour. I will be up the second this is over and my next patient will be standing. So I'm, you know, and then, so it's, exactly. Wonderful.
Fantastic. And it does help with fertility. People should know that if they're having issues. Aerobic exercise has been shown to help with fertility too. So it can help you before you get pregnant and during. And there are only a few modifications to make if you're doing an exercise program while you are pregnant. So you'll talk to your OB-GYN about it. So I have another question if we have time. We have time for one more?
One more, and perhaps Dr. Miller will come back and join us again.
Oh, I would love to. It's so fun to talk to you guys. I always enjoy talking to you.
Yeah, it's really fun talking to you too. And so you specialize in integrative medicine as well as traditional Western medicine. And I was wondering if you were taught more about the use of medicinal herbs in the non-traditional training and what your thoughts are about if you've ever used any medicinal herbs or medicines, and what your thoughts are about pregnancy. I mean, I know that they're particularly, it's a little concerning about the effects on the baby, but maybe you know, but as an integrative medicine specialist, you probably know a lot more.
I do. I know a lot more, and I know a lot more to have a healthy respect for herbs. So that hasn't changed. So I still will tell my patients that I don't recommend any herbs until they talk to their OB-GYN, or we talk together and we look up each and every one of them. So I have all sorts of handbooks and lists, and some that I know are going to probably be okay. But again, each person's individual. And I don't want someone thinking, oh, this is probably fine, and taking it because they saw something online, right? And so I want to make sure that we really know. Like, here's an example. So rosemary, the herb, is wonderful. You know, if you make a little rosemary flavored vegetable dish, I love a little bit of rosemary on it, or on your potatoes. That's wonderful, right? Wonderful. No risk, no harm. But if you take rosemary as a supplement, it can actually be detrimental to the fetus. So then it can be too much. And so it's something as simple as that. You might think, oh, well, this is anti-inflammatory. It's such a healing thing. It has antiviral and antibacterial in my stomach. I'm going to take a little extra rosemary, and now you might get yourself in trouble. So it's as simple as that. The difference between a healthy food, the amount that we're eating at meals, where I'm not really concerned, versus somebody even making it into a tea, right? For certain things, we don't want it to cause preterm labor or dilate our cervix early on accident, like without realizing it, right? So I'm very cautious. We do see, there's one I recommend all the time to my pregnant women, and that's ginger. Ginger is extremely beneficial for many women. I won't say all, because everybody's different, but it can help with the nausea. Absolutely. In a safe way. So I will use ginger and help them make fun teas and do different things with it. And there's a couple others that I like to use, but in general, my rule of thumb with herbs is it's always to talk it over with your OB-GYN. I'm happy to help, and I go through them. I scrutinize over each one and make sure nothing's interacting, and know your past history. So I know you particularly, and what time, where you are in your pregnancy, but I'm very cautious with those.
Right, especially in the third trimester. People are always talking about, anti-inflammatory this and anti-inflammatory that. Well, you have to be careful in the third trimester.
Right. That's exactly right.
Right, because you could prematurely close something in the baby's heart that needs to stay open while the baby's inside. That's the ductus arteriosus.
That's exactly
right. We don't recommend people take non-steroidal anti-inflammatory drugs, and it's the same thing with really super anti-inflammatory kinds of foods.
Yeah, even things like turmeric. I'm cautious with my turmeric supplements. I don't want my women taking that when they're pregnant, because everything changes at this point, right? And so I want them to eat a good, healthy, plant-based, whole food diet that's varied, that's maybe tailored to them for what their needs are a little bit. And then I don't want them taking even simple things like an NSAID or turmeric, or that otherwise would be okay. Mm-hmm.
Right. I think people were doing that too, and they think about the virus, about the COVID-19, about boosting their immune system. But then you find out that actually, it's in some ways, some people get sicker because of that overactive immune system. So you want things in balance, not over. It's not about sort of boosting one side and not anyway. Yes.
And no, that's exactly right. I always say that too. You never want to boost your immune system, because that leads to autoimmunity, right? And allergies, like we talked about. So we want a balanced immune system. We want one that's tolerant, that knows what's foreign to attack those viruses, and what's self to love on ourselves and not attack us, right? So we're looking for a tolerant immune system and not to boost it. Absolutely. Yeah. Good points.
Because now they're actually finding that steroids, which are actually, sort of suppressing the immune system, are actually turning out to be quite a good treatment for. So anyways, just for people to understand, I think for people to understand that it's not you can have too much of a good thing. I didn't really understand. So that's a rosmarinic acid. Is that the toxin that's bad for babies? Amazing.
And I have all these great sources, and I think it just gave me a healthy respect for the herbs, even herbs that I like, when to use them, when there's precautions, and when you need to be careful. So this is just the amount that was in a tea for the rosemary that women were running into trouble.
Wow. So herbs and spices are terrific for eating when you're eating them, but not to be taking during pregnancy, or maybe even before sometimes, but in sort of a concentrated supplement form. There's no reason, I can't imagine, other than ginger I can't imagine really why you would need to do anything else in a concentrated supplement form. Vitamins.
Right. That's where we can get ourselves in trouble, right? Eating whole foods, where we tend to be okay. Yes. Eating a balanced diet, whole foods, as you guys are promoting, as I promote too. But once we start messing with it, that's where even those healthy herbs in concentrated doses, we can run into trouble. And so I have, even though I'm trained in integrative medicine, I have just as healthy a respect for those herbs, and I don't recommend them. So.
Thank you.
Well,
Dr. Miller, thank you so much for taking the time to be with us today, and we look forward to having you back.
Oh, you're so welcome. Thank you. It was so fun to talk to you guys.
It was really terrific.
Loved it. Yeah, thank you.
Thank you. How can people get in touch with you, and can they work with you? And can you just tell us how you would do that?
Yeah, thank you. I am on plantbasedtelehealth.com. So you can go to plantbasedtelehealth.com, and I cover now 20 states. So you can make an appointment with me, and yeah, you just sign up for a portal and then you can make an appointment. They're 30-minute visits. We do it all by telemedicine, so right from your home. And if I'm not in your state, there are doctors covering all the states. So we have, we're covering 40 states right now. We're up to 40, but they're rapidly increasing. We will cover all 50. That's the goal. So we're going to have it covered possibly by the end of the year, maybe just a little bit longer. But
and I heard in Canada too.
Yeah, in Canada. And I actually have patients in France and patients in Dubai, and we have patients in England. So we have to be a little bit careful whether it's medical advice or nutrition and overall just counseling. But yeah, no, we can help.
Fantastic. Right. Is it a fee for service? Do people send, is it just pay with PayPal or Venmo or something?
It's fee for service. It's $150 for a 30-minute visit. And then after that, you're in the portal, and we can order labs, and we can do prescriptions, and you can communicate through the portal. People are sending me messages all the time, so we're talking back and forth, reviewing food journals with them, or helping tweak things.
Nice.
And then they can just schedule an appointment when they're ready, or I can schedule it, or however they want to do it. So yeah, it's super fun.
Well, thank you so much.
Thank you.
See you back again.
Absolutely. Thank you, guys.
All right.